The presence of lithium in drinking water has been associated with a decrease in suicide rates. Greetings everyone. Today's video focuses on a fascinating study recently published in the British Journal of Psychiatry. The study discovered a compelling correlation between the levels of lithium present in public drinking water and suicide rates. As many of you may know, lithium is commonly used as a medication to manage and prevent manic and depressive episodes, effectively stabilizing mood and decreasing the likelihood of suicide among individuals with mood disorders. This comprehensive study compiled research from various locations worldwide and revealed that naturally occurring lithium in water could potentially be utilized on a community scale to mitigate the risk of mental health conditions, violent criminal behavior, chronic substance abuse, and suicide. Without further delay, let us dive into our discussion. The study, which was published in the British Journal of Psychiatry, analysed global research and discovered a correlation between higher levels of lithium in public drinking water in certain geographical areas and lower suicide rates. Lead author of the study, Professor Anjum Memon, who holds the position of Chair in Epidemiology and Public Health Medicine at BSMS, expressed optimism regarding the potential benefits of increased levels of trace lithium in drinking water. This could potentially have a positive impact on community mental health by reducing the risk of suicide. The prevalence of mental health disorders and suicide rates have been on the rise globally, with over 800,000 individuals losing their lives to suicide annually. Notably, suicide is the primary cause of death among individuals aged 24 years. During these unparalleled times of the COVID-19 pandemic, with its subsequent rise in mental health issues, the need to find solutions for enhancing community mental well-being and diminishing rates of anxiety, depression, and suicide has become increasingly crucial. Lithium, known by the moniker of the magic ion, is extensively utilized as a highly effective medication to manage and prevent both manic and depressive episodes. By stabilizing mood and diminishing the likelihood of suicide in individuals with mood disorders, it proves to be invaluable. Moreover, its anti-aggressive attributes have the potential to curb impulsivity, aggression, chronic substance abuse, and even violent criminal behavior. Naturally existing within the earth, lithium can be discovered in varying quantities within vegetables, grains, spices, and even the water we consume. Trace amounts of this element can be detected in nearly all types of rocks, and through the process of weathering, it is released into the soil, groundwater, and ultimately the public water system. For centuries, the therapeutic properties and positive effects on health attributed to naturally occurring lithium in water have been widely recognized. The Lithia Springs, an age-old sacred spring revered by Native Americans for its medicinal qualities, is particularly renowned for its water enriched with this beneficial element. Interestingly, when 7-Up was first introduced in 1929, it actually contained lithium as one of its ingredients. The potential for utilizing lithium as a preventive measure against the development of Alzheimer's disease and other forms of dementia has been highlighted in recent research. These studies have established a correlation between lithium intake and a decrease in the occurrence of dementia, suggesting its potential as a proactive approach to mitigate the risk of cognitive decline. According to Professor Alan Young, who holds the position of Chair of Mood Disorders at King's College London, a comprehensive examination and consolidation of all existing evidence reinforces previous discoveries from individual studies and establishes a noteworthy correlation between elevated levels of lithium in drinking water and decreased suicide rates within communities. It is worth noting that the concentration of lithium in drinking water is significantly lower than the recommended dosage for medicinal purposes, although the length of exposure may be considerably longer, potentially commencing from the moment of conception. These findings align with the outcomes observed in clinical trials, which indicate that lithium diminishes suicidal tendencies and associated behaviors among individuals suffering from mood disorders. Professor Memon suggested that the next course of action could involve conducting randomized community trials to test the hypothesis of supplementing the water supply with lithium. This approach would be particularly beneficial in communities or settings that have a high prevalence of mental health disorders, violent criminal behavior, chronic substance abuse, and suicide risk. The purpose of these trials would be to gather additional evidence supporting the idea that lithium could be utilized at a community level to mitigate or prevent these conditions. According to Professor Carmine Pariante of the Royal College of Psychiatrists, this study reveals that the distinction between medication and nutritional interventions is not as fixed as previously believed. This discovery presents an opportunity for the development of novel treatments that encompass both realms. By gaining a greater understanding of the positive attributes of lithium and its impact on brain function, we can enhance our comprehension of mental disorders and enhance the overall welfare of individuals suffering from depression and other mental health conditions. This comprehensive study encompassed a systematic review and meta-analysis of previous research conducted in multiple countries, including Austria, Greece, Italy, Lithuania, the UK, Japan, and the USA. The study aimed to establish a correlation between naturally occurring lithium levels in drinking water samples and suicide rates across 1,286 regions/counties/cities in these countries. The research findings have been published in the British Journal of Psychiatry, with support from BSMS and partial funding provided by the National Institute for Health Research, NIHR. Biomedical Research Centre at South London and Maudsley NHS Foundation Trust, as well as King's College London. To support our channel's growth and ensure broader awareness, kindly hit the like and subscribe buttons. This will help us reach more individuals and disseminate valuable information. Thank you in advance.